Thanks for taking the time to join us this morning. Our webinar is focused on long-term care and how you can use the health information exchange. So just to give everybody a little bit of an idea of what to expect, we have a variety of folks on the call today, some different organizations. Some of you are current users that are already a little bit familiar with us. Some of you not so much or haven't used before. So we have a little bit of something for everybody. So we will be presenting some information, a general overview, sharing some tips and tricks and specific use cases for long-term care. We also have a guest speaker that's joining us who is a participant and a user of our services. So I'll have Mary introduce herself in a little bit here. And we are looking for this to be an interactive session. So you will see some polls that are going to pop up on your screen. So we'd love if you could take a few minutes to answer those when they pop up. We're also, really like this to be a collaborative discussion. So again, some of you are already using, so you probably have some good experiences that you can share for the benefit of those that aren't using yet. For anybody that isn't using, we would love to give you all of the information that you need, answer any questions that you have. So please don't be shy. Feel free to chime in. And for any of these discussions, again, you can feel free to unmute. We're not too big of a group, or you can type in that chat feature if you don't have a microphone available or can't answer that way. And to introduce myself, that would probably help, right? My name is Alex Augustino's, and I'm a customer engagement manager here at HealtheConnections. So I work with all different types of organizations on training and using our services. Prior to working at HealtheConnections, I worked in a medical practice where I was a HealtheConnections user myself. So I was in our patient lookup portal on a daily basis. So lots of experience using the system. So for those of you that aren't already a little bit familiar with us and what we do, we're your Area Health Information Exchange, or HIE. You'll also hear us referred to as a RIO, or a Regional Health Information Organization. So we have over 1,700 organizations that are participating and using our services. So all of the little green dots that you see on the map there are our lovely participants, including yourselves. So our participating organizations are all different types of healthcare organizations. We have hospitals, long-term care facilities, specialty practices, primary care practices, mental health organizations, community-based organizations, all different types of healthcare facilities that are taking advantage of our services. We cover a 26-county service area, which you can see again on the map there, that dark gray region. So from the Canadian border down through the central region, southern tier, and Hudson Valley. HealtheConnections is one of 6 RIOs in New York State. So there are 5 other organizations similar to us that cover your other regions. But we will cover in a little bit more detail later on. You do have access to statewide data with HealtheConnections as well. So within that service area that we cover in those 1,700 participating organizations, we have over 600, close to 700 of them that are also contributing their data and making it available to all of those participating organizations. So hospitals and long-term care facilities are among those that are mandated by the Department of Health to share their data, and then lots of other organizations choose to share data voluntarily because of the value that that brings. So there's over 11 million patients in that footprint that are able to receive better care, and over 4 million clinical summary documents that we receive per month. So it's a very robust network of information that's available to you. So overview of our services: Patient Lookup is our core service. It's our web-based portal, gives you real-time access to patient records. So that includes labs, imaging, medications, allergies, family history, social history, pretty much any kind of clinical data that you can think of, we have available in our portal. And we'll be jumping in there in just a moment so you can see exactly what that looks like and where to find that information. Included in Patient Lookup is our image exchange. This allows you to view not only radiology reports, but the actual diagnostic quality images that go along with those. So a great tool for providers to have available, and it does not place the burden on a patient to have a disc with them. Our query-based exchange is what I mentioned earlier. That will give you access to statewide data. So if you have patients that have recently moved or have traveled to the area, if they've received care elsewhere in New York State, not covered by the HealtheConnections footprint, so Buffalo, Albany, Rochester, any of those outlying areas, that query-based exchange will return for you a summary of any of the statewide data that's available. So still saving you time having to track down that information and getting it right at your fingertips. Our My Results service, it's another tab within our system, so you will see this on our demo shortly as well. Any credentialed provider that's using our portal will automatically be configured to see their own results there, and then other staff members can be designated as a delegate to view results for one or more providers. So within that tab, it will query by the provider's NPI number and return any labs, radiology, or transcribed reports. So anything that they've ordered with their NPI, anything that they've been CC'd on that mentions their NPI. So one quick, easy, consolidated place to see all of that information. Our My Alert service allows you to be notified anytime patients are admitted, discharged, or transferred from the hospital or emergency department. So particularly for long-term care, that can be great information to have if you've had to send a patient directly to the ER from your facility, can help you track where they are, what's going on with them. Are you going to be expecting them back to your facility, or have they been admitted? So great information, again, to have at your fingertips, save your staff time having to make calls to the hospital and figure out that information. Our results delivery service is available with EMRs that have the capability. We can deliver labs, radiology, and transcribed reports directly into your EMR. So again, instead of having to call, fax, wait for information to come, or scan it into your system, or route it from an eFax or some other system, we'll put it directly into your EMR exactly where you want it to be, making that process more efficient for you. Our direct mail service is a HIPAA-compliant, secure email system, allows you to safely and securely exchange PHI with other providers or healthcare facilities that also have direct mail. So if they have direct mail through HealtheConnections or through their EMR vendor or some other vendor, as long as that is a direct mail address, you know that you can safely and securely send that information. So a great way to send and receive referrals or for providers to consult with one another and they need to share that patient information. And finally, our My Data service. It's an application that will take whatever information your organization is sharing with us, if they are a data contributor, combine that with all of the community-wide data that we have available on your patients, and organize that into easy-to-use dashboards. And we'll see a snapshot of this in a few moments. So it can give you an idea of where your patients are going, how they're doing, and pull out some of those analytics for you automatically. So again, a really great tool to save you time and give you some efficiency. Oops, I think my screen stopped sharing. Let's get that up there for you. And then at this time, we did want to hear from one of our participants. So I'm going to introduce our guest speaker, Mary Gibbs. She's a post-acute operations consultant at St. Joseph's Health. So Mary, thank you so much for taking the time to join us today. If you wanted to tell us a little bit about your role at St. Joe's and the work that your department does there.
Hi, everyone. Yep, my name is Mary. I'm the post-acute operations consultant at St. Joseph's Health. So we have an accountable care organization of about 16,000 members. So I work both on the ambulatory care team and the inpatient team, really trying to improve transitions of care from the hospital to the skilled nursing facility to home care. So we're constantly monitoring the location of our patients, their progress in therapy, trying to decrease skilled nursing facility days, and just making sure that the patient's in the right place at the right time, right level of care.
Great, thank you. And tell us a little bit about the services that your department uses. How do they fit into your everyday workflow? And what's the value of having that data from long-term care facilities available to you there?
Sure. So we use HealtheConnections all the time. We use the My Data report. Each morning, we run a report to see which patients were admitted to skilled nursing facilities and also the discharges from acute care. So with this information, we're able to track down our patients in our accountable care organization and follow their care from one level of care to the next. And it's really important to us because without HealtheConnections, we wouldn't be able to know where the patients from outside hospitals were. So for example, if a patient discharged from a hospital other than St. Joseph's Hospital, without HealtheConnections, we would have no way to know that. So particularly for long-term care facilities and patients in those facilities, it's really the only way that we're able to know if a patient is admitted back to a hospital or kind of their status.
Great. Thank you for sharing. And anything else that you want to share with us?
I just think, it's a really useful tool. I've actually been using it. Usually the daily report is run by one of the nurses on our teams, but I've been using it a lot for more global information about outside hospital discharge rates to skilled nursing facilities. And it's really an invaluable tool. Happy to answer any questions if anyone has any, though.
Great, thank you for sharing. And for those of you who aren't already familiar, that skilled nursing facility report that Mary was referencing, you can see that up on your screen right now, which gives you an idea of how other organizations are using that data from long-term care facilities. And like Mary just explained, why it's so valuable and so important. So you can see from the snapshot here, that's from our My Data application that we mentioned earlier, it automatically pulls out a lot of that information for you, such as the admits within the last 7, 60, 90 days, tells you exactly who those patients are, where they are, which facility they're at. And it's a really easy to use format. As you can see here, it's pretty simple and straightforward, gives you exactly the information that you need. Well, thank you for your time, Mary, and we appreciate you sharing that information with us.
Thank you so much.
So I want to talk about benefits specific to long-term care and uses specific to long-term care, since that's our focus here. So it helps you send and receive and access patients' medical records as they transition between care settings. So as we know, there's lots and lots of different people that are involved in a patient's care. So for a long-term care facility, you're often receiving patients directly from the hospital into your organization. Once they're leaving your facility, they need to follow up with their primary care physicians, their specialists. So many different people that are involved, oftentimes care management that's involved in that process as well. So giving everybody access to all of that information is so valuable. And that's where the Health Information Exchange has that ease of access for everybody. It's one central hub for everybody to access that information, all of the community-wide data on a patient in one consolidated place that makes it efficient and easy. And again, improves communication between all of those different organizations. Receiving those clinical alerts, like we mentioned, is going to help you keep track of where the patient is at. Are they going to be coming to your facility? Are they going to be in the hospital for a while? Is that going to open up a space in your facility? Having that information is going to, again, help you be more efficient in those places, and can help you identify gaps in care. So particularly, we know with the long-term care groups, immunizations are really important. They're in a community living setting. You're kind of tracking that information, making sure that the folks coming into your facility are up to date on immunizations. Do you need to administer any? So all of that information, and again, when we pop in the portal, we'll show you exactly where to find that. That information's there for you, so it can help you know exactly, again, what's going on with your patients. What do they need when they come to your facility? What have they already had done? Minimize any of those redundancies. If there's lab work that's already been completed, nobody wants to have to be stuck a second time. And we don't want to drive up those costs by repeating testing that's maybe already been done. So again, having that ease of access to that information will help keep you more efficient and give your patients a better experience as well. So with our folks that are on the call, does anybody have any examples of how working HealtheConnections into your workflow has benefited your organization? Anybody have any examples to share? I know we've got some newer folks who maybe aren't familiar yet, but any of our more experienced folks?
It's me again, Alex. I just think that our readmission rates have probably, I don't have any hard data right this minute to share, but I think our readmission rates have probably gone down since we've been able to use HealtheConnections for our long-term care patients, as well as being able to, as I mentioned, decrease those skilled nursing facility days, because it gives us insight to where the patients are going, and then we're able to keep track of them while they're at the facility. So yeah, it's been super helpful there.
Great, thanks for sharing. So we also want to talk about the importance of sharing data for our long-term care facilities. I know many of your organizations are already sharing data with us. If your facility isn't doing that right now, it's something that you may want to consider. It's, again, allows for that seamless exchange of information between all of the different organizations that are caring for a patient. When your information is in the system and available, it's going to help the primary care physicians, the hospitals, all of the other groups that are involved in the patient's care. If patient has been to a different long-term care facility before yours or after, again, having your data there and available is going to help them receive better care no matter which care setting they are in. Also, safeguarding of patient data. So HealtheConnections, we meet all of the standards for the Department of Health and HIPAA as far as keeping patient data safe and secure. As many of you probably already know, long-term care facilities are one of those facilities, if you're an articled facility, that's mandated by the Department of Health to share your data. So not only are you complying with that mandate, but you can be rest assured that your patient information is being kept secure and also widely available to those that need it. HealtheConnections also has a high trust certification. So in the medical field, that's pretty much your gold standard for safety and security. And again, you're improving the care experience for your patients. When your data is available, again, when they're going out to other care facilities, there does not have to be that repeating of testing when they can see what's already been done at your facility. Patients often are not the best historians. They don't always remember, what tests they have or have not had done. In long-term care facilities, you're also probably often dealing with patients' family members, and they also may not always be the best historians. It's a big burden for them to try to remember all of the medical history or bring records with them. So having that information consolidated in the HIE where it's easily accessible to everybody, again, makes everybody's lives a little bit easier and makes the provider not have to repeat any testing. And of course, increase staff productivity. So if there's anywhere that you can save time for your staff, you always want to do that. You're busy, probably understaffed, as many places are. You want your staff to be able to focus on that face-to-face patient care. So if we can reduce some of the administrative burden of having your staff having to spend time on the phone or waiting around for faxes or making follow-up calls when they've requested something and they're still not getting the information that they need, that's a big time suck. It's frustrating for your staff. So having all of this information in a self-serve portal where they can log right on, they can get exactly what they need. It's fast, it's quick, it's easy. It's in one place, so they don't have to have multiple different portals that they're going to. It's all consolidated in one place. It's going to make their jobs much easier and less stressful. And again, free up their time for those other more critical tasks that you want them to be spending their time on. So let me switch my screen here. We're going to go ahead and jump right into our patient lookup portal. For those of you that are already using it and are familiar with it, we're going to share some tips and tricks to make sure you're getting the best experience out of it. For those of you that are brand new, we want to show you exactly what we're talking about. So while I'm getting logged in and pulling that up, does anybody want to chime in? Is there any information that you struggle to find in our portal or anything that's of particular value or interest of you that you'd like me to point out where you can find it? If I'm not hearing anything, hopefully that's a good thing. Hopefully that means that you find everything that you need without an issue. And again, I know some of you are new, so this is going to be something new for you to see. Let me share my screen here. So hopefully you should see on your screen the HealtheConnections My Connections portal. So when you receive your login credentials, you'll land here when you log in. So this is basically your central dashboard for accessing all of your HealtheConnections services and information. So a couple quick things to point out. You've got some tabs across the top of your screen. The resources tab is going to give you a lot of great self-training materials, so you always have something to refer back to. And there's also forms to sign up for our additional services as well. Contact us. We'll get you in touch with our support team. You can reach them by phone or email. They are phenomenal. They will get back to you very quickly. So if you ever have trouble logging in, just general questions on how to use or navigate the system or specific patients information that you're looking for that you can't find, don't ever hesitate to reach out to our support team. They can jump right in. They can look at the same thing that you're looking at. They can answer any questions that you have or go through any troubleshooting that you might have. In the center of your screen is news and notices. Always recommend you take a look at those. We'll make sure to communicate if we have any new features that we're rolling out or if there's any technical issues going on that might affect your service. From the center, you can also access our data contributors in a list form. So this is a great place to go if you're not sure if somebody's data is going to be available to you. You can search right at the top or use your filters over here on the right. You'll see all of the different organizations that are sharing data with us. And as you scroll over with the check marks, you can see exactly what type of information they're sending and what's going to be available to you. Now, again, I know some of you are current users, some of you aren't. Are there any data sources that are particularly valuable to you, or are there any organizations that aren't currently sharing data that you'd like to see? And again, if I'm not hearing anything, then hopefully that's a good thing. And hopefully that means that everybody that you want is already a data contributor. Again, we know, particularly for long-term care facilities, that hospital data is really valuable. And as we already mentioned, hospitals are mandated to share their data. HealtheConnections is connected to all of the hospitals in that 26 county area service area that we cover. And I do see somebody is asking if you can see information from outside of our RIO. So yes, if an organization is participating with another RIO, as we mentioned, HealtheConnections is one of 6 in New York State. So when I pop into patient lookup here, I will show you exactly how to access that statewide data. So while we're talking about that, over on the left-hand side of your screen is where you'll have badges for your services, as we call them. So you probably won't have as many as you see on my demo screen, so don't panic if your screen doesn't look exactly like mine. But if you do sign up for our services, you should have a badge for patient lookup. If you do sign up for additional services like the direct mail or alerts that we were mentioning, then you'll get a badge for those as well. So we're going to pop right into patient lookup. We are in a demo environment, so you are seeing test de-identified data. So the search screen is pretty straightforward. Anything with an asterisk is required. We're going to go ahead and take a look at a test patient. And I do recommend, and again, for those of you that are current users, for fastest results, just use last name and date of birth. If you start typing in first name, any other information, it'll typically take a little bit longer for the query. So for fastest results, just last name and date of birth, and you should get right what you need. If you do have multiple patients, same last name and date of birth, you'll see a few options on your screen. But if you look over to the right or hover over, you get this nice little snapshot with additional demographics, so you can match up and make sure you have the right person. We'll go ahead and click right into the patient's record. And when you first log in, you'll automatically come right here to your summary screen. So you'll see everything's divided out into different categories of information. So it's pretty quick and easy to find whatever it is that you're looking for. You'll also want to note over here on the right-hand side, when you first log in, your data is limited to the last 180 days. We do have full data on all of our patients, but when you first search, it's immediately going to return the last 180. So usually most recent is what you're looking for, and limiting it to that amount, again, keeps our system running faster for you. But you can always go back further if you need to. So some folks get a little tripped up. They think that that's all there is, and they want to go back further. You can always do that. So over here on the left-hand side of your screen is where you'll have all of your controls, and you can either click on show the next 180 days of data or show all data. So you always have that option available to you if you need to go back further, if you're looking for historical information on your patients. And you'll see a little number in parentheses next to each section. That's going to tell you how many records are available in that particular section. So if you do have patients with a pretty extensive medical history, then some of your sections might take a little bit longer to load, and that is pretty typical. So the great thing about your summary screen here is that it's completely customizable. So you can have as much or as little information displayed here as you would like. So again, with your controls over on the left here, you have this button to configure layout. So I'm going to give that a second to load here, and then I can click in. So with configure layout, it's going to show you all of the different categories of information that are available, and then you can customize which ones are the most important to you that you'd like to see populated on your summary screen. So I always recommend once you start using and you get comfortable with what information you need and what sections are most important, pull those right front and center for yourself. If there's other items that aren't super important that you maybe are never clicking into, I would recommend you take them right off. And that again is going to increase your load times, make things run a little bit faster for you. So you can take off anything you don't want to see, anything listed that you do want to see, drag and drop it wherever you'd like it to go, click submit, and it's going to make those changes. And that's per user, so you're not going to mess up the view for anybody else in your organization. And you can change that view as often as you would like to, but it will always remember your settings. So you don't have to do it every single time that you log in. Every time you log in, every patient chart that you access, it's going to remember those settings for you. So it'll always keep that consolidated. So all of our information in our portal updates in real time or as close to real time as we can get it, depending on when our data sources are sending their information. Our hospitals in particular, they send all their information in real time. Some of our practices send it in a batch overnight, but either way, your information should always be pretty up to date that you're seeing in the portal here. Each section will have the most recent data right at the top. You can click on your different headings if you want to rearrange that information. As we're taking a look at our labs here, anytime you see a little icon, if you hover over, you'll get a definition of what that means. So it's showing you that there's critical results or abnormal results. So really quick and easy to kind of visually get to the most important information. You'll also notice when you hover over, you get a little snapshot of information. So it'll tell you the date, the ordering provider, where the information came from. So again, kind of helps you see what you're looking at and what you want to see. Anything you want to take a closer look at, you'll just click right on it and it's going to open up that full record for you. So you'll see all of your results displayed here. And again, they're flagged. So up arrow is going to show you above reference range, below reference range. So again, quick and easy to visually see that important information. You'll also notice within our record, sometimes there's additional links like this view encounter details link. So if you wanted some additional information, you can click there. I do encourage you, once you get logins, once you're using the system, please feel free to click on those links, get comfortable with where information is. Our system's entirely read only. So you can't delete anything, you can't alter any results. So you're not going to hurt anything by clicking around and playing around and getting comfortable with where information is. You'll notice at the top of all of your items, you have a couple of options too. Download report's going to put this in a separate window for you. It will put that into a printer-friendly format if you did need to print, or you can save it as a PDF or whatever other format you'd like and put it right into your own EMR or whatever you need to do with that result. Share and send to me is going to link to direct mail. So again, if you have direct mail with us, it will automatically put this result into a secure message that you can easily share with somebody else, whether it's somebody within your own organization, or if you're referring the patient elsewhere or sharing information with their primary care physician. It's quick and easy to do and entirely secure. If there's multiple items that you'd like to download, maybe you're gathering everything from one date of service, patient was in the emergency room and you want all of those items, you can use the little check boxes that you see next to them. You can choose as many items as you want. You can pick from different sections if you'd like. And then with your controls on the left, you've got your download selected items as PDF. So when you do that, it's going to pop that separate window for you. Anything you put a check mark next to, it's going to combine all of that information into one nice, neat document. So again, you can consolidate it. You can easily share this into your own EMR and have that information right in your system. Your imaging tab is going to show you radiology reports. Again, you'll see line by line, this is exactly identical to what you would get if you contacted a hospital or imaging center to send it to you. You also have the option at the top here to view the actual diagnostic quality image. Your transcription section is where you'll find a lot of your hospital information like op notes, discharge summaries. We know particularly for long-term care, those discharge summaries are important for you. That's information that you're looking for. So again, we can take a look at a test one here. And line by line, same thing you'd get if you had called the hospital to fax it to you, but it saves you the time of having to do that and wait for it to come to you. And again, we're connected to all of the hospitals in our 26 county service area. So regardless of where your patient went, you can easily find that information. Anything you're looking for in transcriptions that you're maybe not finding, I always recommend taking a look at documents. So my documents are down here in the corner, but you can put yours wherever you want. So just depending on how a data source is sending us the information, it may end up in transcriptions or documents. And for your documents, I also recommend View as HTML is going to give you the best format to take a look at those. So if you scroll down, you'll get your office note, plan of care, whatever it might be, depending on that data source. That's right down at the bottom, and your full document with all of the information. And again, you can save this right into your own EMR from here if you'd like to as well. You also have a tab right at the top of your screen for patient documents, so just another way to search and look for that information. Allergies and medications, these are also big ones that are really handy to have right at your fingertips. You receive a lot of that information and your intakes and referrals, but being able to back that up or fill in any gaps that aren't covered in that information, because again, we have community-wide data, so all of those close to 700 data sources are aggregated here for you. Immunizations, again, that's a big one that's important for long-term care. So you'll want to make sure you have that displaying on your summary screen. This will include COVID-19 immunizations, flu vaccines, any type of immunization data that we have available on a patient. And we'll put that right at your fingertips as well. Your encounters section, we have them out in different categories, so ambulatory or inpatient. There's a few other options back on your configure layout. So again, if you're trying to track where your patients are, what's going on with them, where they've been in the past, another great one to kind of have that information quickly and easily displayed for you. Other tabs that we haven't covered yet that we'll want to point out, more patient information at the top here is going to give you demographics, a few different tabs within this one, advanced directives. That's a great one to know that that's there for you as well, particularly with the work that you do, you'll want to have that information. Consent is going to show you a history of the patient's consent with your organization. So if your organization is collecting consent, it's going to show you all of that historical information. If consent isn't built into your EMR and you need to change a patient's consent choice, you can do that from here as well. Insurance info, I always like to point this one out as well. Again, really important information for you, especially your intake and admissions folks. Patients often forget this information, don't have it with them, or again, you might be relying on their family members who maybe don't have access to all of that information. So great to know that this is here as a backup for you to check on that. Statewide data tab. So I know somebody had mentioned earlier in the chat, getting information from other RIOs in New York State, and this is where you can access that information. So in my demo environment, it doesn't populate anything, but for a real patient, if they have received care elsewhere in New York State, somewhere that's a data source with another RIO. So again, that includes pretty much all of the hospitals, as well as many other types of organizations. The statewide data tab is going to pull a query from those other RIOs, and it's going to return a summary for you of any of the statewide data that's available. Also, back on your summary tab with your controls on the left, you also have a button over here for statewide data. So just another way to get to the same information, but that will quickly and easily pull that statewide data for you and make it available. Again, saving you time of having to figure out where a patient went and send out those requests. So before I click out of the portal here, is there anything else that anybody would like me to click into that they might be interested in, or any other information that you're looking for that you want to see where that would be in here? Okay, so I'm going to switch over to my results that we mentioned earlier. So right up here on the left-hand side is the My Results tab. So again, any credentialed provider is going to see their own results here. Anybody else can be designated as a delegate to view results for one or more providers. Oh, and I do see a question in the chat. Somebody wanted to see if we get all of the VA info. So you probably saw, if I click back over here, there is a tab at the top of the screen for VA and DoD documents. So you actually probably won't even see this tab in your actual account when you log in. We don't currently have that connection up and available with the VA and DoD. We are in talks with them to get that connection restored, but as of right now, that is not active and you are not able to access that information through HealtheConnections. Clicking back over to my results. So it'll immediately show you the last 24 hours, but if we go up to advanced search, you can do any time frame, any particular information or a particular patient, and it will query by that provider's NPI number, return all of those results. Just like on the summary screen, it's going to show you anything abnormal, and you've got all the same functionality to view or download those reports from here as well. Clicking back to our My Connections dashboard, I did want to take a moment to take a look at a few of our other services as well that we mentioned earlier. So direct mail, like we said earlier, that is a HIPAA compliant, secure email system, allows you to safely and securely exchange PHI. So it is just pretty much, if you've used a regular email, it's the same thing, but very secure, HIPAA compliant, so you can easily send that information. My alerts. So as I mentioned earlier, we have a lot of different ways that we can customize how you receive alerts and on which patients. So this is just one example of a format that you can receive that information in. But in the My Alerts badge here, you can customize whatever date range you want to see. So maybe you just want to see patients that were discharged in the last couple of days. You can customize that date range. You can choose which type of alert you'd like to see. So again, depending on the work that you do, maybe you just want to see those that are discharged or those that were inpatient admit. So you want to see if your patient transitioned from the ED to inpatient. You can customize that however you would like to. And then down at the bottom, it's going to give you a list of any of those patients that meet whatever criteria you put there. If we click on the detail button, it's going to give you some additional information, such as the reason that they were in the ER or admitted, where they were discharged to. So again, really valuable information to have right at your fingertips. I'm going to switch back over to our slides now, but please feel free to chime in with any questions on the portal. So then we already mentioned consent briefly, but we did want to take a moment to give you some details on consent. So for those of you who aren't familiar already, patient consent is required before you can access any information in the HIE. The good news is that consent process is not terribly difficult. The consent's given per organization. So a patient might see primary care physicians, several different specialists. They might give consent to their primary care. They may deny consent to one of their specialists. It's completely at the patient's discretion how they'd like to handle that consent. But what's important for a long-term care facility is to make sure that you have consent in place, that you have that built into your workflows, and that you're collecting the consent form that's specific to your organization. So if you have any users that are set up for our portal, they can access that patient information. Patients only need to provide consent once. So again, it is a very easy process. It does not have to be updated annually like some other forms that you may have to deal with. So it's quick and easy to collect. Once you have that yes consent in place, it stays in place for the duration of your treating relationship with the patient. On the form, it technically expires 50 years after death. Sounds a little morbid, but that's for public health purposes. But again, for your organization, that means that once you have that yes consent in place, you're good to go. You will always have access to that information to help you care for your patient. Patients can change their consent choice anytime that they would like to, just by notifying your organization and updating the form. Good news is 95% of patients who are asked say yes, which is a really fantastic rate. Again, patients understand the value. They don't have to bring records with them, try to remember all of their medical history. Again, if you're dealing with family members, they don't have to do any of that either. There is a spot on the form if you have patients that are incapacitated and somebody needs to sign on their behalf. If they have a health proxy or a representative, that person can sign on their behalf. And on the consent form, there's a place for them to indicate who they are in their relationship to the patient, so that you have plenty of options to get that consent. And if a patient or their family member does say no, and then a few months down the road, they realize that that would actually be a really good thing to have in place, they can always just fill out a new consent form and update that consent choice and give you access. So no worries if at first they say no. Typically, we find as long as consent is properly explained to a patient or a family member, they're pretty apt to say yes. So important that whatever staff members you have collecting that consent form, that they're trained and they know how to explain that consent and what it means. And we can always help with that. We have consent trainings. We have a consent card with a script of what to say. So we can help with all of that as well. And I do see a question in the chat. Does it include any MOLST or DNR info? The consent form does not. Some of that info potentially can be available in our portal if a data source is sending that information to us. So hopefully that answers your question. Now, an important part of consent, particularly with long-term care organizations, it's always valuable to have that information available to you. But of course, having access to all of this patient information before a patient even comes into your facility is going to give you the greatest value, so that you can get a full picture of this patient and their health and can help you place them appropriately, make sure that you have the appropriate resources for them. If there's patients that have any type of substance abuse or mental health concerns, again, depending on our data sources and what information they're sending, you can see that information in our portal. Hopefully, again, your referrals and intake information you're receiving is robust, but having access to the portal can help fill in any of those gaps in data and make sure that you have a complete picture of the patient's health so that you can prepare for them appropriately. So great thing to do if you haven't already kind of built consent into your workflows. Hopefully you have good relationships with your hospitals and folks that are referring and sending patients to you. If you already have paperwork and an intake package, including that HealtheConnections consent form into that package is always a great idea, so that you can have, the hospital folks or whoever else it is that you're coordinating with, they can have the patient sign your consent form. They can collect that consent for you and then send it on over so that your staff can go ahead and enter that consent and access the information before the patient even comes to your facility. So if anybody wanted to share, I don't know if we have anybody on right now who's currently collecting consent. What's your process? How do you currently collect consent? Is that working for you? And of course, if anybody has any questions about consent, please feel free to chime in with those. Okay, and I see somebody answered in the chat that the Rio consents are part of their admission packet. So that's the process we were just explaining. So that's great that you already have that in place. So it sounds like that's working for you. Now, for those of you who maybe haven't done that yet, or you can always collect consent when the patient comes to you. Again, there's a great benefit to having that information ahead of time, but there's still value in collecting consent when a patient gets to your facility. Then your providers, your nurses, your LPNs, your MAs, whoever's on the floor, taking care of those patients, they can still find value in having access to this information. And I always recommend, the more people that can have accounts in your facility is going to be helpful. Again, it's up to you and your facility who it makes sense to have access, and you do want to make sure that only people that should have access to records have that, but the more people that have it available to them, the more helpful it is. You never want to have just one person who's your Rio person, because if they're out or not available or not on that shift, other people might be missing out on that information. So identifying who's your appropriate staff and making sure that they have accounts and access is always a great idea. And for anybody that doesn't currently have users set up or is looking to set up more users, please feel free to reach out to us. We can help you with that process if you haven't already implemented services, or if you're looking to expand those services, you can always reach out to us and we're happy to help with that. And I hope everybody has a fantastic Friday and a great weekend as well.